I'm a cardiologist. The heart, like the brain, has some of the longest lived cells in the body. If you're lucky, you die with the heart and brain cells you're born with. And you get to a certain age, you start worrying you're losing some along the way. But unfortunately, both the heart and the brain have a very limited capacity to repair or regenerate those cells. Pretty much the only physiologic cue we know of that enhances that ability is exercise. So we've been studying exercise and trying to figure out how it does that, and we think we've found a key pathway that enables it to do that. So there are a bunch of different pathways that all lead to heart failure. It's kind of the common final pathway for a bunch of these things. And it can start with a heart attack, sometimes when somebody didn't know they had underlying problems and a blood vessel gets blocked off and kills a lot of heart muscle. It can be longstanding hypertension, high blood pressure that's not well treated. It can be a viral infection, and there are genetic causes. All of these things can lead to failure of the heart, which really means the heart is unable to keep up with the demands of the body. And the classic thing that people think about is when the heart muscle is weak and can't contract. But there's about half the population we see where the heart muscle squeezes okay, but it probably doesn't relax normally, or there are other abnormalities that create a clinical syndrome that looks identical. And that part of the heart failure population, we really don't have any proven treatments that improve outcomes. So that's the group that we're most focused on, and I think particularly interested in things that not only limit the damage and decline, but it can actually promote repair and regeneration and maybe restore health. This will be a nucleic acid focused drug, so it's kind of elaborate and probably has to be delivered as an injection. And so, it would really be for people who already have the disease, with the hope of both not just slowing the decline, which is what most of our drugs do, but actually restoring heart function and enabling people to get back to health, if possible. The best way to get this drug without taking the injection would be exercise, because that's what we're modeling in a sense. And exercise does so many other beneficial things for you that for those of us who can exercise, that is what we should do. But for many of our patients, they can't exercise. And so being able to deliver this in an effective way to people to recapitulate some of those benefits is the dream. So like many people who are scientists or physician scientists in academia, we have a lot of experience thinking about mechanisms and identifying candidates and working on models and taking care of patients, but not much experience with how you take a basic discovery and translate it from the bench to the bedside. And so the group of Harrington Discovery advisors just has an enormous depth and breadth of experience exactly in that, sometimes from a combination of industry and academic roles that they've had, sometimes as CEOs of startups or other companies. And so that perspective and that experience is just enormously helpful to me as I try to understand what are the steps, how do we move this forward. The dream of every physician scientist is that something we discover in the lab eventually is able to benefit patients.